If you're over 50, chances are you've felt this at least once. You wake up in the morning, put your feet on the floor, and your knees feel stiff. That very first step is always the hardest. It's not sharp pain, it's more of a dull, dry feeling, like your joints need a few minutes, sometimes even a few hours just to warm up. Many of my patients have said to me, "Doctor, I walk every day, so why do my joints keep getting weaker?" And here's something very important that most people are never clearly told. Joint pain is not just about getting older. It's a sign that balance inside the joint is slowly being lost. Your cartilage, the cushion that keeps your bones from rubbing together, doesn't have its own blood supply. It survives based on its environment. The joint fluid, the nutrients you eat every day, and the level of low-grade inflammation in your body. When inflammation sticks around for too long, cartilage starts to dry out and lose its elasticity. The joint no longer moves smoothly like it used to. And at that point, pain pills do only one thing. They silence the alarm. They don't fix the cause. My name is David Warren. I'm a doctor who specializes in senior health. I'm 60 years old, and for more than 30 years, I've worked with thousands of patients dealing with joint pain, arthritis, and knee, hand, and hip degeneration. One thing I learned early in my career is this: your joints don't need a miracle. They need the right kind of nourishment. Your body is capable of protecting and repairing itself more than you might think. But to do that, it needs the right building materials. Not expensive or exotic things, often just familiar foods you've never looked at from a joint health perspective before. In today's video, I'm going to share a group of dry foods that I often recommend when the goal is not just pain relief, but keeping your joints moving smoothly for the long run. They support your joints in three key ways: calming low-grade inflammation, protecting cartilage cells from damage, and helping the joint environment stay hydrated and flexible. I won't promise that your pain will disappear in a few days, but if you understand the process, use these correctly, and stay patient, many people over 60 that I follow notice a clear difference within just a few weeks. If you want to move more comfortably, if you want mornings to stop feeling like a battle with your joints, and if you want to give your body a real chance to repair itself naturally, stay with me. Let's start with the first idea, the most important foundation for healthy joints after 50. Part 1. Calm hidden inflammation. The first step to let your joints breathe. Again, in older adults, joint inflammation rarely explodes all at once. Most of the time, it's low-grade inflammation that lingers quietly for years. Think of your joint like a metal hinge. If fine dust and moisture keep getting inside, it won't jam immediately. But day after day, it moves less smoothly. Silent inflammation works the same way. It doesn't cause severe pain right away, but it dries out the joint environment, exhausts cartilage cells, and reduces the smooth quality of joint fluid. Over time, even small movements can become uncomfortable. Here's the key point. If you want joints to recover, you must lower the inflammation temperature first. When baseline inflammation goes down, joints straighten more easily in the morning. That dry, gritty feeling when standing up fades. Joints make less noise when moving, and fatigue comes more slowly during walking. Many of my patients describe it the same way. It's not that the pain is completely gone. It's just, my joints feel less uncomfortable. Movement feels easier. That's a sign the joint environment is stabilizing. To calm silent inflammation, there are three simple but powerful principles. Principle 1. Prioritize healthy fats. Your body needs the right types of fat to produce anti-inflammatory signals. Good fats help joints maintain natural lubrication. Principle 2. Avoid the more is better trap. Many people think eating more means faster results. In reality, too much fat can burden digestion and backfire. Principle 3. Eat with main meals. This helps absorption stay steady, reduces digestive discomfort, and keeps blood sugar stable, which lowers inflammation. Consistency matters more than complexity. In my clinic, I often tell patients, your joints don't need you to do everything at once. They need you to do one thing right, and long enough. If you wake up with stiff joints, feel heaviness when walking, or notice dryness when standing after sitting, then the first step isn't harder exercise, it's reducing the inflammatory load on your joints. Once inflammation settles down, everything that comes next, nutrition, movement, recovery, finally starts to work. Part 2. Protect cartilage cells. Don't let your joints wear down in silence. Many people believe cartilage wears out simply because it's used too much. But in reality, cartilage also breaks down because of cell-level damage. Inside the joint, each cartilage cell constantly fights. Oxidative molecules produced by inflammation, mechanical stress from movement, and uneven nutrient delivery with age. When these cells are damaged repeatedly without protection, they weaken, regenerate more slowly, and cartilage becomes thinner, drier, and less elastic. That explains why some people don't move much yet still have joint pain, while others exercise lightly but their joints keep weakening. The real issue is cartilage cell quality, not just how much you move. When cartilage cells are better protected, deep internal joint irritation eases, joints become less sensitive to cold weather, standing up and sitting down feels smoother, and joints overreact less after light activity. Patients often describe it clearly. Before, just going to the market made my joints ache. Now I need much more movement before I feel tired. That's a sign cartilage is tolerating load better. No longer so fragile. To protect cartilage cells, focus on 3 things. Point 1. Prioritize natural antioxidants. They help neutralize harmful particles that damage cartilage and slow joint tissue aging. Point 2. Be consistent every day. Cartilage doesn't recover in one shot. It needs repeated protection day after day. Point 3. Avoid excess sugar. High sugar increases oxidative stress and quietly accelerates cartilage damage. No need to complicate things. Just eat right, eat moderately, and eat consistently. I often tell older patients, your joints aren't as old as you think. They've just been neglected for too long. If you have unexplained joint pain, deep lingering aches, or joints that feel weaker every year, start by protecting your cartilage cells, not just masking surface pain. When cartilage is protected, joints decline much more slowly, and you keep your independence for far longer. Part 3. Hydrate your joints from the inside. The key to reducing friction. When you move, a lot of people think joint pain only happens when bone rubs on bone. But long before that happens, joints usually face another problem first. Poor quality joint fluid. Inside every joint is a fluid called synovial fluid. Think of it like oil in an engine. Its job is to reduce friction, nourish cartilage, and help joints move smoothly. As we age, or when inflammation lingers, joint fluid decreases, it becomes thicker and less elastic, and joints start to feel dry and may crack or grind. That's why even small movements can take more effort and cause pain. When the joint environment becomes hydrated again, joints feel smoother when you stand up. The catching feeling in the knees eases, walking longer doesn't tire you as quickly, and morning movement feels more comfortable. Many of my patients describe it in very simple terms. Doctor, my joints don't feel dry and gritty anymore. It's like they've been oiled again. That's a clear sign synovial fluid is improving. To support joint fluid, remember these 3 things. Point 1. Your body needs the right fats. Joint fluid is partly made from healthy lipids. Without good fats, fluid quality suffers. Point 2. Water helps, but it's not enough. Drinking water is important, but it can't replace nutrition. Joint fluid isn't just water, it's a complex biological structure. Point 3. Gentle movement pumps joint fluid. When joints don't move, fluid stagnates. Light movement helps distribute it evenly. Slow walking, gentle joint circles, or light stretching each day is enough. I often remind patients, joints hate being ignored, but they also hate being pushed too hard. If you hear your joints crack when standing up, feel heaviness or dryness, or struggle most in the morning, focus on improving the joint environment, not just chasing pain relief. A well-lubricated joint hurts less, wears down more slowly, and heals much more easily. Part 4. Provide the building materials. Joints can't repair without supplies. Many people ask me, Doctor, can cartilage repair itself? The honest answer is yes, but only to a limited degree, and only if the body has the right building materials. Cartilage isn't lifeless tissue. It's made from protein, collagen, and water-binding structures that give it elasticity. As we get older, collagen production drops, regeneration slows, and many people unknowingly eat too little protein. The result, cartilage doesn't just wear down from inflammation, it also lacks the materials needed to repair itself. When the body gets enough building blocks, joints tolerate load better, deep aching pain gradually eases, joints feel less weak when standing or climbing stairs, and recovery after light activity is faster. Many patients tell me, I used to be afraid to walk because my joints felt weak. Now I just feel mild tiredness, not that deep ache. That's a sign connective tissue is being nourished properly. To support cartilage building, follow three key principles. Principle 1. Don't fear protein. After 50, protein needs don't drop like many people think. Low protein weakens cartilage, tendons, and muscles. Principle 2. Choose easy-to-digest sources. Digestion slows with age. Easier to digest protein improves absorption. Principle 3. Pair with supportive vitamins. Some vitamins help turn protein into usable collagen. Without them, the materials are there, but can't be used. You don't need large portions in one meal. What matters is spreading intake evenly through the day. In clinical practice, I often say, joints are like an old house. You can clean it, reduce inflammation, oil the hinges, joint fluid. But without building materials, the structure keeps weakening. If you have long-lasting joint pain, feel weak even after pain improves, tire easily after light activity, ask yourself, does my body have enough materials to repair itself? With the right support, consistency, and patience, many of my patients see clear improvements in mobility within a few months. Part 5. Calm pain signals. Help your joints. Speak up. Less in daily life. Joint pain doesn't come only from mechanical damage. In many cases, pain appears because the nervous system becomes overactive. When joints stay inflamed for a long time, the body produces more pain messengers. Nerves around the joint become hypersensitive. Even small movements can trigger pain signals. That's why some people don't look severe on imaging, but feel intense pain, and others hurt more in the evening, despite light activity. At this stage, the issue isn't just the joint. It's how the body generates and amplifies pain signals. When pain signals calm down, sharp pain decreases, deep evening aches soften, sleep improves because joints stop talking all night, and light daily movement becomes easier to maintain. Many patients tell me, my joints aren't perfect, but they don't control my whole day anymore. That's a critical turning point. When pain eases, the body dares to move, and joints finally get a chance to heal. To calm pain naturally, remember three things. Point 1. Keep blood sugar stable. Big swings raise inflammation and pain signals. Balanced eating calms the nervous system. Point 2. Match nutrition with daily rhythm. When you eat, rest, and move affects how pain is felt. Many people hurt more at night due to fatigue and accumulated inflammation. Point 3. Don't rely on medication alone. Pain meds have their place, but overuse trains the nervous system to expect more pain relief. Sustainable pain relief means reducing the need to send pain signals, not just blocking them. I often tell patients, the goal isn't to never feel pain, it's to make sure pain doesn't run your life. If you hurt more in the evening, ache even at rest, avoid movement because of pain, focus on calming the pain signaling system. When joints become quieter, you sleep better, move more easily, and stay patient with recovery. Part 6. Turn everything into a sustainable habit. Healthy joints come from the right rhythm, not short bursts. An aging body doesn't recover like flipping a switch. Joints, cartilage, and connective tissue need consistent signals, a stable environment, and enough time. Everything we've talked about, lowering inflammation, protecting cartilage cells, hydrating joints, supplying building materials, calming pain signals, only works when repeated daily within the right lifestyle rhythm. Do it one day, forget the next. The body can't remember. When these habits stick, joints feel more stable, fewer sudden bad days, movement feels safer without fear of sudden pain, and anxiety about joints fades. Many patients say, "Doctor, I don't think about my joints all day anymore." That's when joints stop controlling life. I often suggest a simple framework. Morning eat steadily, gentle movement to wake up joints, daytime balanced meals, avoid high sugar, move regularly, don't sit too long. Evening, calm the body. Avoid heavy inflammatory meals. Perfection isn't required. Consistency is. Remember this, your joints don't need more effort. They need you to stop doing the wrong things for a long time. If you've lived with joint pain for years, tried many things but quit halfway, lost trust because progress felt slow, I understand, but directed patience is what creates real change. Today, we covered the most important foundations for joint health after 50. Lowering silent inflammation, protecting cartilage cells, improving the joint environment, supplying building materials, calming pain signals, and most importantly, building the right habits. I won't promise your joints will feel like they did at 30, but I truly believe that if you do this right, you can move more easily, feel more confident, and hurt less each year. If this video helped you understand your own joints better, please subscribe so I can continue supporting you on your journey to active, healthy aging. Disclaimer: this video is for educational purposes only and does not replace personalized medical advice. Please talk with your healthcare provider before making any changes.